Joining us now is Dr. Alfred Shtainer, and we're going to be talking about all things dealing with the urinary tract. Hello, hello, hello.
Hi, Donna. Thank you for having me.
I'm excited to have you, doctor, because over the years, over the 15 years I've had this show, I haven't really covered this topic. And it's so important, whether it's in the female anatomy or the male anatomy. We're going to be talking about various things that deal with urology. What made you decide to have that as your specialty?
So it's a good question. Basically, when I thought about medical specialties, it came to me that you basically become a general practitioner or you choose some kind of specialty, and that specialty in a surgical field. And so among all the surgical fields, it happened to be that my father had kidney stones. So I happened to visit a lot of urologists, and I found them to be very friendly, and they seemed to be accessible. And when I went to actually medical school and did some rotations, I continued to be interested in the field. So I did my residency in Manhattan at Mount Sinai and Beth Israel Hospital. And now I've been very happy being a urologist.
Now, kidney stones is very painful. In fact, my brother lives in St. Louis and he just was able to pass a kidney stone, but then he had to have another surgery where they tried to break it up into little pieces. What causes a kidney stone? What is the purpose of that?
So remember, kidney stones probably are genetic.
Okay.
So that they kind of run in the family. And I mentioned that my father had them. Guess what? I had them.
Okay.
And
but you weren't able to treat yourself, were you?
Well,
kind
halfway.
of?
So
okay.
halfway. So I passed some stones,
right?
But I also had procedures. I had the lithotripsy, which is what you mentioned about shockwave therapy to the stones, which, by the way, we're going to mention again when it comes to erectile dysfunction.
Okay.
But I've had several procedures, but before I was able to book a procedure, I was in severe pain, and sometimes I had to give myself pain medications so that I can wait to see my other urologist.
Yeah. We're talking about that, but it is very painful, right? An erectile dysfunction or difficulties. It's not really dysfunction, is it? Is it more difficulties now? It's still ED. What are some ways that someone can diagnose if they have that type of a situation?
So let me just say that it's a problem that affects men of all ages, okay? And it's a simple question. Have you had a time when you just couldn't get an erection firm enough for intercourse? And let me tell you, in my office, I see men of all ages as soon as they become sexually active, because not all causes of erectile dysfunction are physical. Okay, stress, anxiety, maybe somebody's too interested in their partner, they're anxious, they're nervous, something goes wrong. Maybe they don't have such interest in their partner, the same thing. So the important part is to really try to diagnose where the problem lies, okay? Of course, there are little things like Viagra, Cialis that people take. Great, they give you a temporary blood flow improvement, and that is sort of like a Band-Aid. It doesn't really get you better on your own. Now, my job is to get that blood flow in there. I can talk about it with a patient, I can ask him 100 questions, but at the end of the day, he wants that firm erection. So one of the novel things that we have in the office now is we can actually see if there's a real blood flow problem. Okay,
and it's through something like ultrasound or through?
Exactly. Okay. It's called penile Doppler ultrasound.
Okay.
And we can actually see the flow and the speed velocity of blood into the penis. So remember, you have to have good inflow, but also it has to stay there. Because if it just flows in and flows right out, it's not firm.
Okay.
So you have to bring it in strong, and you have to clamp down on the drainage. So the arteries bring it in, the veins have to stop draining it, and for that time, it's a firm enough erection. So we do the penile Doppler, we check, okay, and then we decide what to do. Now, the interesting thing, we talked about kidney stones, is that we have something called a low-intensity shock wave therapy. So to break stones, which are deep in your body, you have to use high-intensity shock wave therapy. And this is called low intensity. It's painless, it's done in the office, and you do it in several sessions. And basically what you're doing is you're delivering shockwave therapy to the vessels in the penis up and down the whole shaft. Okay, and what that does, it stimulates growth of new vessels. So the beauty is you're trying to create something that wasn't there, or was there and not working well enough. Now, to add to that, we also looked at the orthopedic field, to cosmetic field, and we realized that something called PRP, which is platelet-rich plasma, which actually comes from the patient himself, it has a lot of growth factors in it. And so by shocking the tissue and then by giving the patient's platelet-rich plasma, you're able to even accelerate the stimulation of new blood vessels. So
that's fascinating, because most of the times that I have physicians on, or I've known about it for plastic surgery purposes, but this is the first time I've actually learned that that also could be a technique used for that. So,
and the interesting thing is, speaking of plastic surgery, not only is PRP used in erectile dysfunction, but we'll mention it briefly in female incontinence, where we actually use Botox.
Oh, okay. Now, what are some of the reasons that females would be incontinent? I was telling you backstage, is it stress? Is it, what causes that release?
Okay, so just briefly, what is incontinence? So incontinence is just involuntary leakage of urine. It occurs in both men and women, but for today, let's just discuss women. And so the leakage can be caused by several reasons, okay? Say in older women, maybe in women who had several children, the anatomy starts to just decrease or sag a bit. And by what happens is that during any kind of pressure on the stomach, or coughing or laughing or even getting up, creates this pressure, which instead of stopping the flow, actually pushes some of the urine out. So we call that stress urinary incontinence. And I don't mean stress as a nervous stress, I mean as in physical stress, just as a pressure.
Right. Okay,
so that's something called stress urinary incontinence.
Okay.
Now there's another one, which is more of a nervous bladder, which you probably have seen on TV. It's called the overactive bladder. Okay, the overactive bladder is that there's really nothing wrong with the anatomy. It's still sitting well. It doesn't necessarily affect women who had children, very often young women and even children. And that's when the bladder fills up a little bit, not really a full bladder, a little bit, and they start getting this severe urge to go.
Okay.
And if there's a bathroom next to you, then great, you can make it and you won't get wet. But if there's any delay, that urge can literally push the urine out. And so you may be wet, and you may have to use some pads and other things. So these are the different things we need to figure out.
And I also think education for simple things. For instance, after intercourse, it's important for a woman to drink water, because it will flush, or at least, UTIs, because of, various reasons, can be very, very painful and very damaging to women. So what are some suggestions, and maybe that's just a wives' tale, what would you suggest to help decrease a woman getting a UTI?
Okay.
And do men get UTIs also?
Yes.
They do. Okay, I didn't know.
Big field.
Okay.
A big number of patients that come to us. And UTI stands for urinary tract infection. And remember, to get that, you need to introduce the bacteria into the bladder.
Okay.
Okay, so how do you introduce it? One of the ways, not the only way, but one of the ways is sexual intercourse. So just bacteria, regular bacteria, very often E. coli, it just lives on the skin, and during intercourse, it gets sort of pushed a little bit into the short canal that women have, the urethra, and creates a UTI. Now, a lot of women have recurrent UTIs. They literally every month get a UTI. And if they're sexually active, some of the things that I recommend. So, as you said, drink water, and after sexual encounters, try to urinate and flush it. But as I always say, some bacteria have real sharp nails, and even flushing doesn't help. So what we sometimes do is we take a very mild antibiotic, and we prophylactically prescribe it to the patient to just take one pill after sexual intercourse, just to prevent that infection. If that doesn't work, we sometimes use long-term, low dose daily to keep the flora of these bacteria down.
Interesting. I mean, obviously, urology is a huge subject. Is there anything that I didn't touch upon on a surface level that you might want to mention?
I think that let's just quickly mention, let's just say incontinence, I said Botox, of course,
Right.
which is interesting. So just to mention, some women who have this overactive bladder, the bladder that's very nervous, we have medications, we have pills, we even use little wires, and we do electric stimulation to keep the impulse of urination down. But in some women, we actually inject Botox inside the bladder to kind of temporarily paralyze this overactive muscle that just keeps trying to
So
push.
that they could get a little relief.
So they get relief
Right.
for maybe 4 to 6 months.
Okay,
Now,
interesting.
having said that, let's talk about prostate problems in men. And so again, every man is born with a prostate. In young men, it's usually an inflammation, an infection, has very often to do with sexual activity. And that's called prostatitis. We're going to leave that alone for a second.
Okay.
But let's go into the older men and talk about two very important things. Probably every other older male in my practice has this problem. And that is benign prostatic enlargement, which can cause nighttime urination, slow urinary stream, urge to go to the bathroom, maybe even blood in the urine. And of course, there's prostate cancer. And you cannot tell by the symptoms which one it is. Okay, again, prostate cancer is also, like kidney stones, is genetic. So you have to look into your history. Does my brother, father, uncle, grandfather, anybody has a history? But beside that, you can document the symptoms, but you really have to go deeper. And one of the things that we do is, of course, we have to do a blood test called PSA, which we start screening after 50, 55, maybe earlier if you have family history of prostate cancer.
Okay.
And very importantly is in the office, we can feel the prostate to see if there are anything suspicious, and we can take ultrasounds and image the prostate. So pretty much in one visit, we can tell if we're treating something that may be a prostate cancer, or it could be just a benign problem that then requires medication, and even something new, because I said that I will talk about novel treatments.
Yes.
We have a procedure called Resume, and we actually use radio frequency and water vapor to shrink the size of the prostate, which takes about 5 minutes in the office, painless. And again, it's something that prevents bigger surgery that we used to do 10, 20 years ago.
And also, it also reduces someone's dependency on certain medications.
Yes.
Because sometimes those types of things were only treated with pharmaceuticals, and now there are treatments, and also ways of diagnosing things earlier to prevent people from having prostate cancer by getting that PSA read. At what age you said? Around 50, unless they have symptoms.
Yes, I would say that probably around 50, 55, and every year it seems the pendulum seems to swing. Sometimes we get recommendation to do it later because of just population statistics to see whether or not diagnosing cancer late in life, are you really saving them, or you just know that you have it, but they kind of live their life. So it's a very active field. We have national meetings and international meetings, which, by the way, I just came back from a meeting in Edinburgh and in Dublin. And this is all as, on front line of what to do with patients. It's a very common problem.
And did you ever say thank you to your dad for helping instill your why in life, your whole journey? Had he not had kidney stones, maybe you would have been something else. But
that's true. That's true. Well, I'm glad that he had something relatively benign. It could have been worse. I could have been a different doctor, but it could have been worse.
Yes. Thank you so much. I really appreciate your time and your expertise. And I know that there are people out there that are suffering, and they just need to have a little bit of knowledge and the courage to step forward to get help. So thank you very much.
It's my pleasure.
If you are concerned in any type of urology type of cases, please reach out to the doctor no matter where you are in the world, and I'm sure that they will give you some advice or at least put you in the right direction to get some help. Be well.